Welcome to Komizo Diagnostics. This is a patient education tool and a diagnostic assessment tool for both physicians and practitioners, therapists. What it does is put everything onto a dashboard for you to quickly be able to assess, make different decisions clinically, and educate your patient all in one step. I use this site next to my EHR to be able to help show patients why I'm looking at different things or different actions or problems that come up. I can quickly reference and give them a visual picture that actually makes sense to them, which helps me in giving validity to the care that we're doing, but also it helps them come on board so they understand why we're doing certain activities, such as we're doing therapies. This is really slick. It's all put together in one simple little format. So when you see these regions, this is actually talking about the overview of the anatomy based upon different highlighted areas that go into anatomy. And when you select the regions, it does it very fast to bring it to the areas of in a gallery format. They can look at and see the different areas that are causing pain based upon the trigger point referral. Then you have a muscle index, which goes into the alphabetical side of it. And gives all the muscles that are on our site that are listed with their summary pages and all their referrals in picture form, as well as stretches that go with that. Then you have one that has to do with the disc level, where all the disc levels and the spinal nerve that associate bring up pictures of the muscle referrals, trigger point referrals in purple, and also the dermatomes as a reference. Then you have also organs, that organ referral patterns that are also for a reference, and then some patient education tools here. So to understand quickly how this works, especially in our clinic for educating the patient, is that you select a muscle group from a list or from the region. You can get there. But a very important part of this to understand is you see, here's a picture of the supraspinatus. This right here is the trigger point referral pattern. And so you have this icon here causes the purple. So the purple is the patient's pain. The icon called the Komizo dot, that Komizo dot is the cause of the purple. So it helps you to be point specific, and all you have to do is go into that. It even helps in the summary page to have the muscle so you know where to look, because that Komizo dot is located in this muscle band here. Then it quickly gives you the nerve reference in which area to look for if you're doing either injections or if you're doing specific chiropractic adjusting. All these areas to go after to find the irritation to the nerve to the muscle. That way you're dealing with both the neuro control, but also the muscular contracture. And then it also gives the patient home care stretches right here that you can show your patient on how to educate them on how, in this case, to stretch the supraspinatus muscle. It gives specific instructions on how to improve the actual function, like how many times they're supposed to do in reference to a set 3 times a day. You can make this up however you want to for the patient's needs. Then there's sometimes a clinical correlation that's below there. It explains exactly some little findings about how to correlate that with your patient. And then, of course, the supraspinatus Wikipedia link at the bottom. All of them have a Wikipedia link. And so you notice that it goes through and you can get more information based upon findings just selected from the site. So an overview of this, it's just meant to be a very fast, quick assessment tool. And sometimes I have patients come over and they just have them pick and select the area of where they're hurting. So if they come in and they say, for instance, they're having neck pain, they select the neck and then they see all the reference of the neck. Or if they're coming in with a headache, we go to the region of the head, and you can pull in and essentially select the area closest to it, and they're broken up by regions. And so when you select the forehead, then you can see all the muscle referrals. This one has it right here. It comes to the forehead. You can see all of them that traverse through that pain pattern that they selected via criteria. And then when you do, you select the area, it will bring up the summary page of that muscle, again with the large and enlarged area showing the trigger point referral patterns. And then you can point to the dots of these areas here that cause the purple. Again, the anatomy below it, the nerve, as well as action, and then the actual stretch with the stretching instructions. Sometimes there's that clinical correlation there to kind of explain to your patient some findings, like this one has sinus pain, or earache is a common thing that's seen with an SCM referral. So somebody comes in with a chronic earache and it doesn't seem to go away. This could be the reference based upon that. And then, of course, the Wikipedia reference. So this is just a little overview of what this is, and we'll go into detail with more tutorials. And if you'd like to learn more, select tutorials here from that, and you'll be able to go through step by step each one of the tabs on how they operate, and you get to find out how you use it clinically. But I use this with this in regards to my EHR. I put it right next to it so I can select it, and it is web-based, so it's easy to find. And then I just go through and use this as an education tool to teach stretches to them. I have my staff do that. One of the coolest parts to make this proficient in your clinic that I've found is that if you find, say for instance, if you go in and you select a region and you pull up upper back and you find that you have found a trigger point in the trapezius muscle, what you do is you go through and pick this area, and I use a Sharpie, and I'll just take a little black Sharpie and I'll put a dot right on the trigger point, and then I just hand the patient off to one of my staff members and I say to him, all right, I need this therapy done, whether that's percussion massage, ultrasound, you could do injection, you could do massage work, deep tissue massage. I just select the region area, and then there's no question about where I'm asking them to work, which has been shown in my practice is that I got better clinical outcomes because, man, they're very specific about their therapy with that. You can even put a laser over an area that has this dot and be able to even get focused benefit to the patient. This has really been awesome for that. Plus, it has the anatomy for the education. It has the stretches. I know where I'm looking for with a nerve bundle that would be controlling this muscle. So we're all about being proficient. So having a staff member, and I do have staff members that actually go through this with the patient. They just select the regions and then they walk through it with the patient, and the patient finds the area that's closest to their pattern. So they select the region that looks like it, and then I have them essentially I mark that area for them. I already know what muscle group it is and just find the exact spot. You can even take and put a specific acupuncture needle right there, or dry needling right into that area to be able to help improve that pain pattern, and then give them the home care exercises that go along with that. So very awesome part of that. So we're all about trying to be proficient and be as accurate as we possibly can. Then what I do is I list in my EHR note, and I just put in there levator scapula, and I rank it 0 to 3 based upon findings. So a 3 is going to be worse, a 0 is going to be where it's back to normal. So I rank them, and then I can use that as an objective tool to follow up with each time I see the patient. And that also drives home of why I'm doing specific therapies, whether that's I'm doing traction, or if I'm doing a laser, or if I'm doing dry needling. I'm trying to get these trigger points to reduce, and the patient will notice that they feel better almost instantaneously, because when I hit this dot, they get relief. Oftentimes, one thing is when you're doing some deep tissue massage, you may even cause the pain pattern to refer. That's oftentimes seen with headaches. So when you go in and you select, say for instance, the most common one I see with when it comes to chronic headaches, especially with people working at computers, is the trapezius migraine, if you would, or trapezius headache. This comes up as a horseshoe and around into the eye. And I'll go after these dots right here just by pressing into it. When I hit that, one of two things usually happens. Either it refers pain up to the area or region where they're having a headache, or it immediately starts to relieve it. So that's one good reference. When you get a hold of these trigger points, the patient will oftentimes go, that's it, or they'll wince away from it. And if you can just have them hold through that pain, they will actually notice that their pain patterns will start to reduce down each time when you let go of that. So that's why we target that with specific therapy. So this is one of the reasons why we created this site, was to be able to help people reference through these very fast, but also to help educate patients with that, because a patient that's educated about your care is going to be more likely to commit through your treatment protocols, as well as to refer people to you because they think that you're the rock star. You know, you've got the program, you've got the information right there in front of them. Instead of having to reference materials, we're going into a textbook or trying to find it on the internet. It's all located in just one area that you can pick from to be able to help utilize as tools in your toolbox to be able to show them exactly why you're doing what you're doing. So the more they know, the more likely they're going to use your services, but also they're going to call on you when they have a crisis to understand, because you seem to have found and identified all their problems. So this is the reason why we designed Komizo Diagnostics to function like this. And so, again, select the tutorials to learn more about each one of the tabs.